Hey, my name is Kayla. I'm a nursing student at the University of South Alabama, and I will be doing my medication administration checkoff. I'm going to be working in a no interruption zone, and I'm just going to scan my area. So the first thing that I'm going to do is in a no interruption zone. I don't want to take any phone calls. I want to close the doors and not have a lot of conversation with colleagues. I want to do hand hygiene first. And after I do my hand hygiene, I'm going to look at my order and my MAR, and I am going to compare the two. So I have Mr. Jaguar J. Jones, Mr. Jaguar J. Jones. I have date of birth 8/25/1963, 8/25/1963. I have medical records number 4176352, 4176352. He has an allergy to penicillin, and I see where he has an allergy to penicillin. Now I'm just going to go over the medicine that we're going to be giving him and make sure that it is correct. So I have Novolin R regular insulin, U100 insulin, 10 units subcutaneously, 30 minutes before meals. So now that I've verified that everything's transferred over correctly, I'm just going to be working off my MAR. So now what I'm going to do is perform hand hygiene again. I'm going to go ahead and start drawing up my medication, and I'm going to go over my rights. And so I want to make sure that I have the right medication. So we are doing Novolin R regular insulin, and this is U100. So it is Novolin R regular insulin, U100, and the expiration date is 12/1/2025, so it is not expired. And now I want to make sure that I have the right patient, Mr. Jaguar J. Jones. And now I want to make sure that I have the right route, and we are giving this subcutaneously, so I'm going to choose a insulin syringe, and we are doing 10 units is the dosage, so I want to put 10 units of air in here. We want to make sure that we have the right time, so it's 30 minutes before his meals, and we are going to look and see that it is 11:30, and he has lunch at 12, and he has not had the medication yet, so we're right on time. The right indication is going to be for his diabetes, and we I do not have any documentation yet. So now that I've verified that I have the right medication, the right patient, and the right dosage and the right route, I'm going to go ahead and get an alcohol pad, and I'm going to clean the top of my vial. And I'm going to push the air in. I'm going to draw up 10 units. And I would expel any air bubbles if there were any. And I am going to use the scoop technique to put my cap back on. And I would verify this with another RN. So I do have 10 units drawn up. And now what we want to do is go ahead and make a label and start our second set of rights. So I am going to make the label now, and it consists of the patient's name. So we're going to start with right patient, Mr. Jaguar J. Jones. And we want to make sure that we have the right medication. So we have Novolin R regular insulin, Novolin R regular insulin, and I did draw up insulin in the syringe. So we're going to write regular insulin. And we want to make sure that we have the right dosage, and it's 10 units, and I did draw up 10 units in the syringe. So we're going to write 10 units. And then we want to make sure that we do have the right route, and I do have a insulin syringe, and this is for a subcutaneous injection. And it's going to be given to him 30 minutes before meals. And I did check. It is 11:30, and he gets his lunch at 12, so we're right on time. And it will be given for his diabetes, and I do not have any documentation at this time. So I'm going to put my label on here. I'm not going to cover up any of the numbers or anything like that. I'm just going to put it at the bottom. And we are ready to go into our patient's room now. So now I am going to take my MAR with me. I'm going to take my vial and my syringe in with me. So I'm going to knock on the door. Hey, Mr. Jones, how are you? My name is Kayla. I'm going to be your nurse today, and I'm going to be giving you your insulin. So I will perform hand hygiene. The first thing that I want to do is look and make sure that we have the right patient, and we're going to use 2 identifiers. So I have Mr. Jaguar J. Jones on my MAR, and on my patient's bracelet, it says Jaguar J. Jones. And also his date of birth is 8/25/1963 on my MAR. So I have date of birth 8/25/1963. And also, Mr. Jones, it says you have an allergy to penicillin, so I'll just need to see your allergy bracelet. And I do see that you have the allergy bracelet on for penicillin. Are there any other allergies that I need to know about? Okay. All right, so now what we're going to do is go ahead and we're going to raise our patient's bed up to a working height, and we are going to lower his bed rail down. We're now going to start our 3rd check of rights. So we want to make sure that we have the correct patient. So we have Mr. Jaguar J. Jones, and we want to make sure that we have the right medication. So we have Novolent R regular insulin, U100 insulin, and I did draw up insulin in here. I want to make sure that we have the right dosage, 10 units. I did draw up 10 units. I want to make sure that we have the right route, subcutaneous, and this is for subcutaneous injection. And this is 30 minutes before meals is the right time, and it is 11:30, and his lunch is at 12, so we're right on time, and he has not had it yet. And it will be for his diabetes today is the right indication, and I do not have any documentation at this time. So this will go in your abdomen, and now what I want to do is go ahead and put on some gloves. And I'm going to put on my goggles. I would do any pre-assessments on my patient. For Mr. Jones, it would be to check his blood sugar before giving him this medication. So now what I'm going to do is get an alcohol wipe. And I'm going to wipe, starting in the middle, going out. And I'm just going to leave my alcohol pad there to mark my spot. And I'm going to take my cap off. I'm going to take my alcohol pad off. We're going to pinch the abdomen. We're going to go in at 45 degrees and inject. And we are going to immediately come out and put our syringe in our sharps container. I'm going to go ahead and throw my cap in there as well. And we're going to ask our patient if he's okay. Mr. Jones, you feeling okay? Okay. All right, so now what I'm going to do is go ahead and I'm going to lower my patient down to the lowest level. I'm going to raise his bed rails back up. I'm going to go ahead and take my goggles off. I'm going to go ahead and take my gloves off. I'm going to, after I take my gloves off, let my patient know that I'll be back in about 30 minutes to reassess him to make sure that he's still feeling okay. I'm going to perform hand hygiene. And I'm going to go outside and I'm going to document my rights. So I would document that my I would document the right patient, which is Jaguar J. Jones, and I would document the right medication, which is Novolin R regular insulin, U100 insulin. I would document that I gave him the right dosage, 10 units, and I would document that I gave it to him subcutaneously in the abdomen, and I would document the right time, that I gave it to him 30 minutes before meals, and I would document that it is for his diabetes, and I would also document how he tolerated the procedure. And that concludes my checkoff, my medication administration checkoff.